A really smart fellow told me once when I was young that you will never work a day in your life if you love what you do. I love vascular access. I truly believe that I have not even had a job for the last 5 years since I started vascular access consulting. The passion I have for this field has driven me on a personal and a professional level. My mission in life, really it's my calling, is advance the practice of vascular access and infusion therapy and eliminate complications. Seeing the innovation, whether it's a brand new technology or something that has been around for a long time, maybe used in a different way, that helps eliminate complication. That's what really excites me. I feel alive. I've been asked on occasion, what important issue is currently underappreciated or maybe not receiving as much attention as I believe it should? You know, this reminds me of something that happened to me. I've been a nurse for approaching 30 years, and vascular access and infusion has been a focal part in my training. And as a trained vascular access clinician, I have literally placed tens of thousands of devices, changed, honestly, thousands of central line dressings. Now, that gives you a little perspective here. What I'm going to share with you shocked me. I had the privilege of participating in a program called the Jamboree in Northwest Indiana. A well-known infection preventionist invites all the vendors who have products in her hospital to round on the patients that have these devices. It's like a turbo point prevalence study, but the difference is that there are 10 to 15 experts on the products that are there evaluating everything about the vascular access devices. It's just miraculous. While I was there, one of the staff reported needing to change a central line dressing and asked me if I wanted to come along. Of course, I accepted. I said this would be my pleasure. As we approached the patient, I kept thinking to myself, is she going to change that dressing? Like, what is she doing? That dressing hadn't been on for 24 hours. I've done a lot of dressings. Years ago, we would place a 2x2 gauze and then come back 24 hours later to, change the dressing. It's kind of an old practice, but it's common. This dressing, in fact, had a CHG sponge on it, so didn't need to be changed. There was no reason that I could see to change the dressing. So I started to gently ask some questions. So what's your policy about the frequency of CVC dressing changes? And the nurse replied, every 7 days. And then I was like, oh, I have her. I got her now. Like, then why are you changing that dressing? That dressing hadn't been on for 24 hours, maybe 2 days at tops. And the nurse replies to me with a real puzzled look on her face. It's been on for 7 days. What? You could have knocked me over with a feather. I could not believe. I just couldn't believe it. I made her show me the date on the dressing. How is this possible? And the nurse explained, we use Mastisol. We use it to keep the dressings fully intact. And I was like, Masta who? In my pursuit to eliminate complications, I've taken a huge interest in catheter securement and stabilization. To give you a quick definition, when I talk about catheter securement, what I mean is attaching the device to the patient. with dislodgement ranging from 1 to 17, and in one study it's up to 30%. The dislodgements can delay treatment, decrease patient and nurse satisfaction, and drive the cost higher and higher. Now, stabilization, on the other hand, is preventing the movement of the catheter within the skin and the vein. That's how I define it. The micropistoning of the catheter can drive the bacteria into the bloodstream. And I've done some research in this area, and it led me to a project called the Pitfalls of Catheter Securement. You can see these presentations about that project on the AVE Academy. It's the learning platform for the Association for Vascular Access. What I did is I demonstrated different configurations of catheter securement. Adhesive engineered device, securement dressing, subcutaneous anchor, skin glue, even dressing enhancements. And then I combined the different modalities and pulled. During the demonstration, I measured the pull force that each scenario yielded. Through that process, I realized that the dressing, along with the securement modality, increased the pull force, and that was over 2.5 times. It was like a light bulb went on. We have to keep the dressings on, and we have to keep them on over time. This took me back to that moment in Northwest Indiana when I mistook a dressing that had been on for 7 days for a 24-hour dressing change. Honestly, to decrease vascular access and infusion complications, keeping the dressing intact for 7 days is going to decrease your bloodstream infections. It's going to decrease dislodgements. It's more likely to affect the phlebitis, infiltration, and even occlusions.